Oh, no, we're not.
The broadcast is now starting. All attendees are in listen-only mode.
Okay, we are good to go now, Robin. Robin, are you there? It's recording now.
Okay. Good afternoon. Welcome to the webinar entitled Quality Care No Matter Where, Successful Nursing Home Transitions. Next slide. My name is Robin Grant, and I'm the Director of Public Policy and Advocacy at the National Consumer Voice for Quality Long-Term Care, or Consumer Voice for short. Next slide. So for those of you who may not be familiar with us, we're a national nonprofit organization that advocates for quality care for consumers receiving long-term services and supports in any setting. So that includes services at home and within the community, in assisted living, and within a nursing home. The focus of this webinar today is to share with you the findings of a project that Consumer Voice conducted on nursing home transitions. So the goal of the project was to determine what could be done to improve the nursing home transition process for nursing home residents who leave the nursing home to go back into the community. Next slide, please. In the webinar today, we want to talk about why we did this work, give you some background on nursing home transitions and the Money Follows the Person program, tell you about the individuals we interviewed, and then share with you what we learned from consumers who had transitioned and from the people who work in the programs that assist consumers in transitioning. Finally, we want to share with you the policy recommendations that we developed based on information that we gathered during the project. Next slide, please. So joining me today in presenting this webinar are Amanda Celentano, who is the Program and Research Associate with Consumer Voice, and Jenny Coyne, a consultant with the Consumer Voice who worked with us on this project. Next slide. So let's start by discussing why we did this project. Across the country right now, there is a growing push for states to increase their home and community-based services to allow people who need long-term services and supports to receive those services in their own community, and preferably in their own homes. All you have to do is ask any older adult or a person with disabilities, and you'll hear that remaining at home is exactly what they want. So part of allowing consumers to receive those services at home includes preventing people from being admitted to nursing homes in the first place, while at the same time helping individuals who are currently living in nursing homes to return to the community. In 2013, Consumer Voice staff talked to individuals who had actually moved out of nursing homes and into the community, and this was in California. We talked to them about their experiences, and we learned from them that moving from a nursing home into the community can be difficult, particularly if an individual has been in the nursing home for a long period of time, or if the person is living with a disability for the very first time. So the difficulties faced by nursing home residents who want to transition can really impact the success of the move back into the community. After that work, we wanted to learn more and to look at transitions not just in one state, but nationwide. We also wanted to get the perspectives not just of the individuals who had moved back into the community, but also of the folks who work with the programs that assist them. Next slide. So the goal of our project was to identify ways in which the process of transitioning out of a nursing home and back into the community can be improved. And because we know that the better the transition process, the more successful the transition is for consumers. Next slide. There are a growing number of federal programs that now exist to help support a state in shifting to home care. One such program, Money Follows the Person, which I'll refer to just as MFP, was authorized in 2005 and is designed to assist nursing home residents who wish to leave the nursing facility and transition back into the community. So it was initially authorized to be funded through fiscal year 2011, but MFP has been extended to September 30th, 2016 through the passage of the Patient Protection and Affordable Care Act in 2010. Right now, 44 states and the District of Columbia offer MFP programs to nursing home residents. And since the program began, MFP programs across the country have transitioned close to 41,000 individuals. Now I'm going to turn things over to Amanda to talk about how we identified consumers who had transitioned and to talk about the consumer perspective. Amanda?
Thanks, Robin. Can you access the slide? Can you move the next slide, please?
I sure can, if it will move. Okay.
Thank you.
There we go.
Thanks, Robin. So through a tremendous amount of reaching out over several months to people and organizations in and out of our network, we located close to 100 individuals who had transitioned from nursing home back into the community. Of those, we were able to successfully interview 63 consumers from 12 different states. 56 were female and 44 were male. Next slide, please. The ages of participants varied. The youngest person we interviewed was 31 and the oldest was 91. Slightly over half of these individuals had spent less than 2 years living in a nursing home before transitioning, and one gentleman had spent 14 years of his life in a nursing home before moving back to the community. Next slide. Those are some quick stats on the consumers we interviewed, and now we're going to talk about their experiences preparing for transition, the day of their transition, and after transition. Next slide. We asked consumers how they first found out about their transition options and found that Medicaid waiver programs, independent living centers, and other residents were the primary sources. The second most common sources of information were local advocacy groups, area agencies on aging, and MFP programs. Next slide. There were 4 individuals that said they learned about their options to transition from the nursing home, but most consumers found the nursing home to be minimally involved. This was a common complaint among the people we interviewed, and it's something we're going to discuss later on in the webinar. Next slide. After learning of their options, we wanted to find out how consumers were involved in preparing for their transition. Many said their biggest involvement and biggest problem is finding affordable and accessible housing. Finding a place to live is a difficult task for anyone, but trying to do so while living in a nursing home is much tougher, especially with little or no assistance. Several consumers said they participated in regular meetings and asked questions throughout, which helped them feel heard and let them know what steps they needed to take. But overall, it appears that many consumers felt they were minimally involved in the preparation phase and that others were taking care of things for them. Next slide. Next, we asked consumers what they felt a person needed to do or think about before moving. They told us that people really need to think about being able to get around, both in the household and in the community. And they said that in the household, people need to think about things such as getting in and out of bed on their own and moving their wheelchair if they have one in the apartment. they shared with us that a really important point to think about is public transportation. Consumers said that you need to start the process of getting connected to transportation as early as possible. One person advised others to fill out the application for free transportation while still living in the nursing home because, as he put it, it doesn't happen overnight. Another high priority for consumers was support. One person who had transitioned commented that independence after a nursing home is not the same as it was before the nursing home. Next slide. So how did the actual transition or moving day go for consumers? In general, most people felt the actual move went smoothly, and most had help from their family or friends. We did hear from several consumers who thought the nursing home should be more hands-on during the move by helping them pack their belongings. However, while the transition went well for most people, it did not go well for everyone. 4 had difficulty obtaining things like paperwork from the nursing home on the day of the transition. 2 did not receive new wheelchairs at the time of relocation. 1 consumer needed both a wheelchair ramp and a walk-in shower, but neither were ready the day of his move. And 2 individuals said that critical furniture was not in the apartment when they moved in. 1 stated that there was no bed or chair in her apartment upon arrival, so for the first 2 nights she had to pull a chair from the hallway into her room, and she would sit on the chair with her legs propped up on her walker to sleep. Another consumer had to spend the first night on the couch because her bed had not been delivered. Next slide. Have been living back in the community just under or over 1 year, although a few individuals have been out of the nursing home for over 10 years. In general, the biggest adjustment was taking care of daily tasks themselves, activities such as getting in and out of bed, transferring to and from their wheelchair, preparing meals, and simply moving about inside their new home without assistance were difficult tasks for many to adjust to. One consumer said it was hard to adapt to getting up to do dialysis and getting dressed with no assistance. Another described how she'd wash her clothes in a sink or just throw them away once they were dirty because doing laundry was such a challenging chore for her to do. And few were very open in admitting that they were things they missed from their nursing home, such as friends and someone cooking for them. Next slide. Activities of daily living, such as those I just described, were major topics for people to think about when transitioning, but consumers noted other aspects of their new lives that they wanted others to think about when moving out of a nursing home, like staying active. The individuals we spoke to really felt it was critical for people to stay active once they were back in the community. One individual, a former president of his resident council while in the nursing home, continued to stay social and active by going to everything he possibly could that was available to him in a senior living complex. He'd even go to things like dialysis workshops, even though he didn't have that issue. Another interview said he found out that college courses were free after a certain age, and he could take classes for his own personal enrichment for free. Across the board, consumers agreed that transportation was an enormous issue. Many of them had to rely on paratransit transportation, which runs the same day and hours as fixed-route public transportation that offers door-to-door services to qualifying people with disabilities. Basically, paratransit allows the individual to be picked up at their house so they don't have to figure out a way to get to the bus stop or train station. But the paratransit vehicles are now not always on time and can be very late, making it really hard to get to appointments or activities and taking up an enormous amount of time. And lastly, a support group. Consumers felt that having a support system was essential. Having a support system is the greatest asset when transitioning, as one consumer and many others agreed. Everyone interviewed needed support in some shape or form and to various degrees. Many said they received support from their family and from transition programs and home care aides. Next slide. All right, now I'm going to turn things over to Jenny Coyne so she can share with you the perspective that state and local long-term care ombudsmen, MFP directors, and local transition coordinators have on nursing home transitions based on surveys and interviews she conducted with individuals across the country. Like the consumers we interviewed, these individuals were asked about consumer experiences pre-transition, during transition, and post-transition. Next slide.
Thanks, Amanda. I appreciate it. Thank you. First, I'm going to start with local ombudsmen and transition coordinators and what they reported. And they said that there were a number of issues that consumers faced during the preparation phase. But 62% of the folks that we interviewed stated that lack of affordable and accessible housing in consumers' preferred location is a major issue. Numerous ombudsmen and transition coordinators also commented that consumers may experience anxiety, fear, a lack of family support, and a sense of being overwhelmed by all the decisions that need to be made during the preparation phase. We found that consumers often endure long wait periods without knowing the status of their case. In addition, 12% of local long-term care ombudsmen and transition coordinators felt that there is often a lack of communication between the support planning agency and the nursing facility staff. Based on their experience, TCs and LTCOs recommended 4 actions they felt would make the preparation part of moving out better for consumers. Next slide. Oh, next slide. Oops. Thank you. So number 1 that we found out is involving consumers in the planning process and including family and friends who have offered to help to create a realistic, workable plan. One respondent believed that consumers may have unrealistic expectations of what they're able to do independently. For that reason, they recommended having consumers demonstrate their ability to do activities of daily living. So that would be while they're in the nursing home and going through the process. And here's what a transition coordinator wrote. The consumer needs to be involved 100% and accountable, and stressed that the coordinator must be aware of all of the medical needs, including the ones the consumer doesn't tell you about. The second item that came up is providing ongoing education, which includes training and materials for nursing home facility social workers, discharge planners, consumers, and family members on the transition process, including resources and community living options. The third item that came up is developing more community resources, including affordable and accessible housing, transportation, and mental health services. And finally, maintaining open communication between all parties involved so the consumer is not getting mixed messages along the way. An ombudsman suggested having more planning meetings so that everybody is on the same page. Next slide. So this is during the actual transition, the local programs ideas. And so let's look now at what ombudsman and transition coordinators said about the actual transition. Over half of the respondents reported that adequate services and supports are not always in place for consumers. This includes durable medical equipment, a 30-day supply of medications, furniture, food, assistive technology, household appliances, and household items. One respondent indicated that consumers frequently need guidance and assurance on the day of transition because nursing facility staff have not followed through on agreed-upon actions, such as providing filled prescriptions or assisting them with packing their belongings. Next slide. The major recommendation from local ombudsmen and transition coordinators for improving the moves was full cooperation and coordination among all persons involved, which includes planning the transition, including the consumer, transition coordinator, facility social worker, ombudsman, case manager, and family. Make sure all assistance needed for the move is set in place before the move date. And ombudsman recommended better coordination among everyone involved to make sure that everything is set up prior to a person leaving. Other suggestions included hiring the home care staff before the consumer transitions out of the nursing facility, utilizing a navigator or transition coordinator to work through issues and access resources that arise, getting support and assistance with packing of personal belongings from nursing facility staff. Next slide. And finally, let's look at after the transition. After the move out of the nursing home, transition coordinators and ombudsmen alike, 78%, noted that consumers often feel anxiety and shock in their new environment, They face a number of responsibilities they didn't have before, like being independent and responsible for decision-making and day-to-day management of their budget, medication, and transportation needs. Another big change was a lack of access to around-the-clock care. One transition coordinator remarked that consumers had to adapt to not having a call button and instead of having to wait for caregivers to come on scheduled times. TCs and LTCOs stated that there were other problems consumers encountered as well, such as durable medical equipment not always being available or delivered on time, and promises to help not being kept, and or lack of support from family and friends. And lastly, there can be broken equipment, unreliable transportation, and home care staff that doesn't show up for work. Next slide. To address those problems, TCs and LTCOs had a number of suggestions. The majority felt that thorough planning with cooperation and coordination among all persons involved in planning is essential. They also believe that there needs to be a strong support team comprised of the transition coordinator, ombudsman, case manager, family, and friends from start to finish to assist addressing issues and concerns. There were other recommendations as well, including consumers need to be provided with access to community resources and tools for being successful at home. Some of the resources included utilities assistance, a discount cell phone, transportation, and prescription refills. The tools don't have to be complicated and could be something as simple as a calendar and a schedule for medication. Next slide. So let's look at the other folks that we interviewed and talk a little bit about the state experience and what's working well. While local ombudsmen and transition coordinators provide help directly to consumers, state long-term care ombudsmen and Money Follows the Person program directors work to coordinate and collaborate with partners, access resources, and create a system responsive to consumer needs. That's why we felt it was important to gain their perspectives as well. The two major questions we asked state directors and state ombudsmen were, first, what part of the transition process are working well for consumers? And second, how could the process be improved? The majority of state ombudsmen and MFP program directors, 89%, stated that collaboration with partners in a team-based process was going well and benefiting consumers. They reported that collaboration and ongoing communication regarding policy development, sustainability planning, and coordination of services contributed to the success of nursing home transitions. This collaboration was primarily done through a statewide advisory group for nursing home transition. It's also interesting to note that the ombudsman role as an advocate and educator was mentioned as a natural fit for successful nursing home transition work. This is largely because ombudsmen have always been involved in assisting consumers with transitioning into the community and can help consumers resolve problems during the transition process. Next slide. In terms of how the transition process could be improved, the state ombudsman and MFP directors said that by far the biggest issue that needed to be addressed was affordable and accessible housing. Right now, the process of finding and securing housing can take quite a while, which often delays transition. They reported that additional housing options are desperately needed, including small residential care homes. State ombudsman and MFP program directors also stated a need for education of two groups. First, nursing home staff. They said that nursing home employees need to be educated on community living options and the transition process. Second, the second group that needs education are home health staff and case managers. These professionals question whether it's really possible for people to live in the community and are frequently referring consumers to adult protective services once they transition because they don't think consumers are capable of making it outside of the nursing home. Now I'm going to pass things back to Robin as we discuss recommendations we've crafted based on our findings after gathering the consumer and program perspective.
Thank
Robin?
you, Jenny. Yeah, next slide. So what can we conclude from this information that we collected from consumers, state and local ombudsmen, state MFP directors, and local transition coordinators? Our findings show that in general, consumers returning to the community from a nursing home and those helping them through the Money Follows the Person and long-term care ombudsman programs believe the transition process is working relatively well. Nevertheless, we can see that there are significant barriers impacting the success of a nursing home transition, and we analyzed our information in order to come up with recommendations to improve the transition process, really from start to finish, and we came up with 10 recommendations that we would like to share with you right now. Next slide, please. All right, the first one is to form a state advisory group for nursing home transitions. Collaboration, coordination, and ongoing communication with partners in a team-based process was reported to contribute to the success of nursing home transitions. So several state long-term care ombudsmen and MFP program directors noted that their state has a nursing home transition advisory group. So we concluded that a strong advisory group should be comprised of really a whole host of individuals and agencies. It should include state agencies that are responsible for Medicaid, disability services, aging services, housing and disability and developmental disabilities and mental health, as well as representatives from the state's No Wrong Door or Aging and Disability Resource Connection. It should also include advocacy groups, long-term services and supports provider agencies, and absolutely must include consumers, family members of consumers, and caregivers. And in order to ensure that the voice of consumers is really heard and well represented, we recommend that a significant number of consumers should serve on the state advisory group. The focus of this group should be on policy development, sustainability planning, and coordination of services. Next slide, please. All right, recommendation number 2 is to create and disseminate to nursing home staff written information about community options, resources, and programs that assist consumers to transition. So as it turned out, not only are residents and family members often unaware of their options, nursing home staff are as well. Facility staff need to know where consumers who want to return to the community can go for assistance. Facility staff also have to have at least an understanding of the local housing and service options and resources in order to provide consumers with general guidance. The need for distributing such information to nursing home staff was really clearly illustrated to us by one consumer statement. And here's what she said: "It felt like the blind leading the blind." When she was talking about the lack of information her social worker had on community options. Another consumer was forced to learn about the state's waiver program himself and then explain it to the nursing home's social worker. We recommend that the lead contact agency, and this is the agency the state contracts with to provide assistance with transition services in the community. So we recommend that that agency develop and regularly update a written list of community transition options and then distribute that list to the Director of Social Services in each nursing home in their area on a monthly basis. Next slide, please. Recommendation number 3 is to require nursing homes to post in a public and easily visible place information about programs that help residents transition. Consumers were very clear that they needed information about transition services. Many said that they had problems getting any information from nursing homes. So according to one consumer, this is what They said, the nursing home didn't offer any information on transitioning to independent or home care living. They wanted me to stay and never leave. They should offer a way for residents who don't need to stay in the home to find the programs that help them leave. And one woman suggested, post information in the nursing home about transitioning and who you can call for information and help. We thought she was spot on, so we recommend that information stating that consumers can transition, along with contact information for transition programs, be posted in facilities in public places where residents, family members, and visitors can easily see it. Next slide, please. All right, recommendation number 4 is to increase affordable and accessible housing options. Everyone we interviewed, consumers, long-term care ombuds, and transition coordinators, it didn't matter. Everyone listed the lack of affordable and accessible housing as a problem that slows down and complicates the transition process. One ombudsman stated, increase available housing. If we're advocating for people to remain in the community, there needs to be housing for them to live in. One consumer expressed frustration that he had to remain in the nursing home for an additional 2 to 3 months solely because he could not find housing. And another consumer said that looking for accessible housing was a challenge because a place may be listed as accessible, but sometimes that just meant you could get through the door. It didn't guarantee the bathroom was handicap accessible. Next slide. And options in the community. Right up there with housing is transportation, which is clearly one of the biggest problems faced by consumers after they move back into the community. This is what one consumer said. Transportation is of the essence. People need to be free to go and not sitting at their home. Another consumer reflected that she was fortunate that the public bus stop was near her home because she could get out to talk to and meet new people. And she said that without access to transportation, she didn't know how she could cope. In order for consumers to successfully live in the community, they must have access to readily available transportation. Next slide, please. Recommendation number 6. Provide greater support to individuals returning to the community. Connecting with someone who has already successfully transitioned to the community or connecting with others who are in the process of doing so can be a particularly powerful source of support and assistance. And we identified a number of different ways that support can be provided. So it can be provided by using peer mentoring. And a peer mentor gives the consumer suggestions and ideas that are based on his or her own personal experience and firsthand knowledge. And that's something a transition coordinator just can't do. So peer mentors can also provide knowledge, information, and understanding, and they can also develop with the person who's transitioning a meaningful and supportive relationship during the transition process. And this relationship can be particularly important since a number of interviewees reported that isolation and loneliness was something they experienced a great deal after they had been around so many people in the nursing home. It was a big difference between living in the nursing home with lots of people and all of a sudden being by yourself. So if a paid peer mentoring program isn't feasible, support can be provided by creating a sort of a simple buddy system. And this would just involve connecting a consumer who is transitioning to a person who has already transitioned. Forming support groups is another way to provide support. So support groups can be good because they bring a number of people together who are going through similar experience. This gives them the opportunity to share their own experiences, compare notes about resources, talk about their feelings, and improve coping skills. And one last idea that we learned through this process is to provide support through community support coaches. These are not mentors or peers, but they're individuals who usually work for an agency, and they provide services and supports to consumers who've transitioned. But they also work to assist consumers to adapt and adjust to being independent and now responsible for their own daily lives. So all four of these approaches provide support in different ways. They help build skills, they give guidance, emotional support, and encouragement to the person leaving the nursing home. And all of these are things that people transitioning really need. Next slide, please. Okay, recommendation number 7 is to establish local groups of peers or advocates. One way to both inform consumers in nursing homes about their options and support them during the transition process is through the creation of a group consisting of individuals who've already moved out of a nursing home. Former nursing home residents who are now living in the community are really the true experts. Such a group is exactly what one consumer we talked to recommended. She felt there should be a program where people who've lived in a nursing home and moved out can talk to residents about moving out, talk to residents and help connect them to the program that actually will help them, and then keep in contact with residents who want to move, just to make sure that things are moving forward and that the residents are receiving the help they need. In the course of our research, we discovered a great example of such a group, and it's called the Sunshine Folk in Maryland. So this group is a group of people with disabilities. We refer to them as SSF, Sunshine Folk. So they're a group who have lived in nursing homes or had other institutional experience, and they all have a real passion for helping other people find their way out of institutions and into the community. So the Sunshine Folk inform residents about community alternatives. They help residents safely transition into the community, and they also alert the Maryland Disability Law Center staff to potential legal barriers that folks who are transitioning may encounter. And they have really had some tremendous success. So in 2014, they met with over 330 nursing home residents. They successfully transitioned 25 residents from nursing homes into the community, and they provided general and personalized information about rights in facilities and community-based options to literally hundreds more residents, family members, facility staff, ombudsmen, and other state and local officials. So this can really be a fantastic way to provide information and support all at the same time. Next slide, please. Okay, recommendation number 8 is to seek written guidance about the role of nursing home staff from the Centers for Medicare and Medicaid Services, which we refer to as CMS. So to seek written guidance from CMS and or possibly the state survey agency about the role of nursing home staff. So several consumers, as well as ombudsmen and transition coordinators, reported having real problems with transitioning because nursing home staff didn't provide the necessary assistance. So, for example, nursing home staff didn't prepare and make available at the time of discharge the necessary paperwork that residents needed and the necessary medications that residents needed when they left. Federal nursing home regulations actually require a facility to provide, and I'm quoting now, sufficient preparation and orientation to residents to ensure safe and orderly transfer or discharge from the facility. In addition, nursing homes have to also assure that, and again I'm quoting, sufficient and appropriate social services are provided to meet the residents' needs, and that includes discharge planning services. So our recommendation is that the role of nursing home staff be addressed at the federal level by having CMS issue what's called a survey and certification letter, kind of an SNC letter. These are letters to state survey directors that provide additional guidance and direction on what the state survey agency is looking for in its inspections or when it's doing enforcement of those regulations that facilities must follow. So we recommend that this letter detail what the nursing home must do to comply with the regulations that I just quoted during the transition process. So that the letter should specifically address the facility's role in transition, so it's very clear. And that role includes tasks such as keeping residents informed, assisting residents with phone calls, assisting them with packing, and getting medications and paperwork ready upon discharge. So those are just some examples of what we think should be included in this S&C letter. But because getting an S&C letter issued might not be successful or might take a long time, we also recommend that state survey agency directors issue guidance in their own states directly to nursing home providers. Okay, next slide. Recommendation number 9 is to identify and/or develop creative, flexible funding to ensure that housing, services, and supports are in place prior to transition. In our research, we found that several consumers had problems with services and supports that were not set up prior to their move. And this is often because services can't be paid for while the person is still in the nursing home. The net result is that this creates a very stressful and possibly dangerous situation for the consumer. We recommend to address this that the transition programs at both the state and the local level actively explore ways to cover these expenses. One possible way to do that is to develop state and local funding sources, so really going out into the community, for example, and trying to find groups, foundations, get donations in order to fund this, or to create a repository for used medical equipment and household items. And finally, recommendation number 10, next slide please, is to provide residents, based on their choice, so it's their decision, but to provide them with a team to support them from the time they decide to transition through, at a very minimum, the first 90 days after they move out of the nursing home. We believe that consumers should have the option of working with a well-defined, formally recognized transition team to create a thorough transition plan that carefully considers their home and community support needs. The people on this team would probably change as the consumer progressed through the transition process. For instance, during the planning phase, the team might consist of the consumer, transition coordinator, ombudsman, nursing home social worker or discharge planner, family, and friends. But after the move, the consumer's team might include the case manager at this point in time, transition coordinator, a home care ombudsman if that exists in the state, a peer mentor, family, and friends. So the team would depend on where the resident is in the process. The team would then provide assistance with addressing issues and concerns, including modifying the consumer's plan of care if that's what's needed, and advocating for more service hours if that's needed. So that the team would be there to basically advocate for what the consumer needs to make that transition successful, and would support the consumer for at least 90 days post-transition. Next slide, please. So this webinar, to sum things up, has been an overview of the information that you'll find in our national report on nursing home transition, which you can download on our website. We also want to let you know about 2 additional resources that stem from the report. One is a how-to guide that's intended to equip state and local advocates with information and tools to advocate for improvements to nursing home transition. So the guide provides strategies and approaches. It provides materials from around the country that can be used to advocate for these recommendations in states around the country. The second resource is a consumer tip sheet that's designed to provide nursing home residents who want to transition with tips to make the move go as smoothly as possible. So these recommendations come directly from people who've already transitioned. We got these recommendations right from the consumers we interviewed. The tip sheet is intended to be used along with a checklist that guides consumers through the transition process, step by step. You can find all of these resources by going to our website, clicking on the Policy and Advocacy tab at the top of the screen next to the red Donate button. And then on the Policy and Advocacy page, you'll see all kinds of what we hope is useful information on all the policy issues that we're working on. Once you're on that page, all you have to do is click Other Long-Term Care Issues and Resources, and you'll see our page on nursing home transitions right at the top of the list. Or you can simply copy the web address that you see on this slide to access our transition resources. Next slide. If you have any questions at all or want to know more about this project, please feel free to contact us at the website. You can get us through the website, you can get us through email, you can call us. Lots of ways to connect with us. Next slide. And finally, in closing, we want to thank you in lots of different languages for taking the time to watch and listen to this webinar. We really hope that it will help you make a difference in the nursing home transitions in your state. So thank you very much.